You look down at your hands first thing in the morning, and they do not feel like your own. Your fingers are stiff, swollen, and curled inward like claws. The knuckles are thick and deeply achy. You try to make a fist, and a sharp, biting pain shoots through your joints. Simple tasks you have performed flawlessly for decades, like buttoning a shirt, opening a jar of coffee, or turning a doorknob, suddenly feel like monumental, agonizing challenges. You mention this to your doctor, and they give you a sympathetic nod, tell you it is just the normal wear and tear of osteoarthritis, and suggest you take an over-the-counter painkiller. They tell you to rest your hands. But relying on painkillers and rest is the absolute fastest way to guarantee your hands permanently freeze into a stiff, unusable state. Today, we are going to bypass the standard advice completely. We are going to show you a biological mechanism to relieve that sharp, biting joint pain in exactly 30 seconds. But more importantly, we are going to over-deliver on the exact mechanical, neurological, and chemical failures happening inside your hands and give you the deep, structural protocol to rebuild them. To get that immediate 30-second relief, we have to exploit a physiological loophole in your joints called negative intraarticular pressure. When cartilage wears down in your fingers, the space between the tiny bones compresses. The bones grind together, pinching the highly sensitive joint capsule. To stop the pain instantly, you must mechanically uncrunch the joint. You do this through a technique called joint distraction. Take your healthy hand and firmly grasp the base of the painful finger on the opposite hand, right near the palm. Do not grab the tip, grab the thickest part of the base. Relax the painful finger completely. Now, gently but firmly pull the finger straight out, away from your hand, holding that sustained traction for 30 full seconds. You are not trying to pop or crack the knuckle. You are simply creating a microscopic physical gap between the bones. This sustained pull creates a vacuum inside the joint capsule, sucking fresh synovial fluid directly into the starved cartilage and instantly pulling the raw bone surfaces apart. The sharp pain will dramatically fade within seconds because you have mechanically removed the structural compression causing it. But joint distraction is only a temporary rescue mission. It is the immediate relief you use to get through the morning routine. If you want to permanently change the trajectory of your hand arthritis, you must understand the massive biomechanical betrayal happening in your forearms and hands every single day. Your hands are an engineering marvel, operated by a complex system of pulleys and cables. The muscles that control your fingers do not actually live in your fingers, they live in your forearms. Long cables, called tendons, travel from your forearm, through your wrist, and attach to your fingertips. You have flexor tendons on the palm side that close your hand, and extensor tendons on the back of your hand that open it. For your entire life, you have lived in a state of chronic, aggressive flexion. You grip steering wheels, you carry groceries, you hold tools, you type on keyboards, and you grasp your phone. You spend 99% of your waking life closing your hands and almost zero time forcefully opening them. Over the course of 60 years, this creates a catastrophic structural imbalance. The flexor muscles become short, tight, and massively overpowered. The extensor muscles on the back of your hand atrophy and become weak, thin, and overstretched. This imbalance means your joints are constantly being pulled off their natural, perfectly aligned axis. The overpowering flexor tendons bowstring across the joints, dragging the bones out of alignment and grinding the delicate cartilage down to nothing. If you do not fix the imbalance between the cables, the joints will continue to be crushed. To fix this, you must aggressively strengthen the forgotten side of your hands. You need a standard rubber band. Place the rubber band around the outside of all 5 fingers on one hand, resting it right around the middle knuckles. Now, spread your fingers as wide as you possibly can against the resistance of the rubber band. Hold that maximum open position for 3 solid seconds, fighting the tension, and then slowly, with absolute control, let the fingers close. You must do this for 15 repetitions, twice a day. By forcing the hand to open against resistance, you are waking up the dormant extensor muscles in your forearm. You are tightening the slack on the back of the joints, pulling the tiny finger bones back into perfect structural alignment, and taking the sheer grinding force off the arthritic cartilage. Once the structure is aligned, we have to address the lubrication. Inside your fingers, those tendon cables glide through tiny, biological tunnels called tendon sheaths. When you have arthritis, Massive amounts of inflammatory fluid pool inside these sheaths overnight. The fluid becomes thick and sticky, which is exactly why your hands feel like they are locked in wet cement every morning. You cannot just stretch this stiffness away. You have to physically pump the inflammatory fluid out. You do this through a specific sequence known in clinical therapy as tendon glides. Hold your hand up high, perfectly straight, like you are signaling someone to stop. First, curl only the top 2 joints of your fingers down, leaving your main knuckles straight, forming a shape that looks like a hook. Hold for 2 seconds. Next, roll the fingers all the way down into a tight, full fist, tucking your thumb on the outside, and squeeze gently for 2 seconds. Finally, open the hand back up, but only hinge at the main knuckles, keeping the fingers perfectly straight, creating a shape that looks like a flat tabletop. Return to the starting position. Repeat this entire cycle 10 times. This sequential movement acts as a squeegee inside the finger tunnels, forcing the stagnant, sticky inflammation out into the lymphatic system and pulling fresh, slippery fluid in. While the fingers take a lot of damage, there is one specific joint that causes more debilitating, life-altering pain for seniors than any other part of the hand: the base of the thumb. This is called the carpometacarpal, or CMC, joint. It is a highly unique saddle-shaped joint that gives human beings the ability to pinch and grasp. But because it is so mobile, it is incredibly unstable, taking the brunt of almost every forceful thing you do with your hands. When the CMC joint degenerates, opening a jar or turning a key becomes excruciating. You cannot pull this joint apart to fix it. You must stabilize the saddle. To stabilize an arthritic thumb, you must build an invisible cast of muscle around the base. You do this through an isometric hold. Form your painful hand into the shape of a letter C, as if you are holding a wide water glass. Your fingers should be curved, and your thumb should be wide and rounded. Take your other, healthy hand and place 2 fingers firmly against the outside of the arthritic thumb. Now, try to push your arthritic thumb further open, while simultaneously using your healthy fingers to completely block the movement. You are pushing hard against an immovable force. Hold this intense, static pressure for 5 seconds, then relax. Do this 10 times. The thumb does not actually move, meaning there is zero friction on the bone-on-bone joint, but the stabilizing muscles wrapping around the base of the thumb are forced to contract at maximum intensity. You are building a biological brace that locks the saddle joint in place so it stops grinding when you use it. We also must address the absolute worst enemy of an arthritic joint: poor circulation. Cartilage needs nutrients to survive, and it gets those nutrients from your blood. But your hands are at the extreme end of your circulatory system. By the time blood travels all the way down your arm, the pressure is lower and the vessels are microscopic. When you have arthritis, the tiny capillaries in your hands are often constricted, meaning the joint is literally starving for healing factors while drowning in its own inflammatory waste. You have to mechanically force the blood vessels to open and close. You do this with a contrast bath, which is essentially a powerful cardiovascular workout for the blood vessels in your hands. You need 2 bowls. Fill one with comfortably hot water, not scalding, but hot enough to deeply warm the skin. Fill the second bowl with cold water and a few ice cubes. Plunge your painful hands into the hot water and leave them there for exactly 3 minutes. The heat forces the blood vessels in your hands to dramatically dilate, rushing a massive wave of oxygen-rich blood directly into the stiff joints. The moment the 3 minutes are up, immediately plunge your hands into the ice water for exactly 1 minute. The sudden cold forces the vessels to violently constrict, forcefully pumping the stagnant, inflammatory fluid out of the tissues and back up your arms. Move back to the hot water for 3 minutes, then the cold for 1 minute. Complete this cycle 3 times, always ending on cold to ensure the inflammation is pumped out. You are manually overriding the sluggish circulation in your extremities, acting as an external heart pump for your hands. But we have to go deeper than just the mechanics and the plumbing. To fill a 15-minute masterclass on your hands, we have to look at the systemic fire burning inside your body. Hand arthritis is not just a localized wear and tear problem. The microscopic joints in your fingers are often the canary in the coal mine for systemic inflammation. Your bloodstream carries inflammatory markers directly to the smallest capillaries in your body, and they settle inside the synovial fluid of your knuckles. If you are doing all the stretches and the contrast baths, but your hands are still throbbing, you are likely dealing with a chemical stiffening of the joint capsule caused by advanced glycation end products, or AGEs. AGEs are destructive compounds formed when protein or fat combines with sugar in the bloodstream. This process happens rapidly when you consume foods cooked in highly refined, unstable industrial seed oils like soybean oil, corn oil, and canola oil. When you eat a diet high in these processed fats, the AGEs travel through your bloodstream and physically cross-link with the collagen in your joints. Remember earlier when we talked about the joint capsule being pinched? The joint capsule is made of collagen. When AGEs bind to it, that flexible tissue becomes as rigid as stiff leather. Your fingers cannot bend, not because the bone is in the way, but because the biological fabric surrounding the joint has been chemically hardened. To reverse this chemical stiffening, you have to flush the systemic inflammation out of your bloodstream. You do this by aggressively changing the ratio of fats you consume. The refined seed oils hiding in your pantry must be replaced with high-quality, cold-pressed extra virgin olive oil. Olive oil contains a phenolic compound called oleocanthal. Oleocanthal operates on the exact same inflammatory pathways as over-the-counter pain medications like ibuprofen, but without destroying the lining of your stomach or straining your aging kidneys. By consuming a tablespoon of raw olive oil daily and eliminating the inflammatory seed oils, you stop the production of AGEs and allow the collagen in your hands to gradually regain its elasticity. There is one final, hidden saboteur that amplifies hand arthritis pain, and it is entirely neurological. Many seniors believe their arthritis is getting exponentially worse because they start feeling a burning, tingling sensation shooting down their fingers, accompanied by deep weakness when trying to grip objects. This is often misdiagnosed by the patient as severe arthritis progression, but it is actually a nerve entrapment issue. The median nerve travels from your neck, down your arm, and right through a narrow tunnel in your wrist called the carpal tunnel. When your finger joints are inflamed, that swelling backs up into the wrist. The tunnel shrinks, and the median nerve is crushed. A crushed nerve sends panic signals down into the hand, making the arthritis pain feel 10 times sharper and more erratic. You cannot stretch a nerve, and you certainly cannot exercise a crushed nerve. You have to floss it. This is called a median nerve glide. Stand with your arm extended straight out to your side, parallel to the floor, with your palm facing the ceiling. Slowly bend your wrist backward, pointing your fingers down toward the floor. At the exact same time you bend your wrist backward, tilt your head in the same direction, bringing your ear toward that shoulder. Now reverse it. Point your fingers up toward the ceiling and simultaneously tilt your head away from the arm. Move back and forth in this exact, coordinated rhythm 10 times. By moving your hand and your head together, you are physically pulling the median nerve back and forth through the inflamed carpal tunnel, breaking up the scar tissue and freeing the nerve from the compression. This shuts off the neurological alarm bells, leaving you to manage only the true joint pain without the amplified burning sensation. Your hands are your connection to the physical world. When they hurt, your entire world shrinks. But you are not powerless, and you do not have to accept a slow decline into stiffness and pain. The 30-second joint distraction will save you in the morning, but the deep biomechanical, chemical, and neurological work is what will save your hands for the rest of your life. Wake up the extensor muscles with the rubber band. Flush the tendon tunnels with glides. Build the biological cast around your thumb. Force the circulation with temperature contrast. Remove the chemical stiffness by eliminating seed oils, and free the median nerve with targeted flossing. You have the complete blueprint to rebuild the function of your hands from every possible angle. The science is absolute, but the execution is entirely up to you. Take control of your joints today. Refuse to let the stiffness dictate what you can and cannot do, and put the structural mechanics of your body to work. This information is strictly educational and is based on clinical biomechanics. It is not a replacement for your physician or physical therapist. If your joints are hot, red, or severely deformed, consult your doctor before beginning any protocol. Take exceptional care of your body, do the mechanical and dietary work, and your hands will respond. And I will see you in the next video.